Spasmodic colic or colic with gas tympany is usually medical, resolving with time. If the case is mild, some exercise, hydration, and maybe some analgesic is needed. Gas tympany can be primary, which is really due to an unknown cause that has inevitably dealt a different or abnormal peristalsis, or secondary to an impaction or displacement that has partially obstructed the lumen and allowed the gas to build up as the fermentation continues. Although this type of colic might present with a variable level of pain, when the abdomen is severely distended, it can be incredibly painful. And in fact, new studies are finding that in some cases, with intra-abdominal hypertension being significant enough to alter the blood flow and perfusion to organs and even compress the lung field. Treatment for gas typically involves time and analgesia. We need to stop that pain spasm cycle. But if that impaction cannot be felt, you can also use an antispasmodic like Buscopan or deflate some of the intestinal viscus. When you can feel the impaction, either in the cecum or the colon, then you need to shift your focus to rehydrating that material to get it to move through. Those impactions are usually treated medically for the most part, and they can affect any area that has a narrow outflow, like the stomach or the cecum, or that has a sharp bend, like the pelvic or diaphragmatic flexures. The small colon can also get impacted, but this is less common and appears to be associated more with a dysregulated peristalsis or even a colitis. The classic sign for impactions are these mild but moderate intermittent colic episodes. To help explain the unique presentation, I tend to personify the case, saying that they eat and then they feel bloated because the food got stuck, and then the ingestus shifts a little bit, so then they get hungry again, and the colic just keeps this waxing and waning cycle. Another classic presentation for impaction colics, especially more distal ones, is that the horse will back up and push its rump against a wall or a fence. And I explain this as a desire for a counter pressure being applied when the obstruction pushes in the pelvic area.